The helicopter emergencies medical services is the next stuff we'll be talking about as we continue building more on the emergency healthcare system. So for this one, just like the name implies, helicopter. So this one, you are basically taking healthcare stuffs to everybody. You're actually using a helicopter. you know so they are actually specialized air ambulances. So it's an ambulance, but it's a helicopter. All right. So these operations are delivered to deliver rapid, because of course a helicopter should be moving faster than a car. All right. So they deliver rapid advanced medical care to people that are so ill or people that are injured. All right. And these people are often in areas that are hard to reach. It could be remote, it could also be in the town, but probably if you want to reach there, you have traffic and all, so you use the air. So the goal is to bring this resuscitation room to the patient. That's to tell you that in this helicopter you have oxygen, you have all those glucose, all those IV, normal saline. You have all the basic things that will keep the person alive, so that I can transport the person from this place to the place where they will receive definitive care. So so you want to actually reduce the time to treatment. So what do they do? This whole thing, what do they do? So they provide pre-hospital critical care. That's before you receive the better care at the hospital, these ones are helping to keep you alive. So at the scene of accidents, medical emergencies, all right, they perform advanced interventions like intubation, thoracostomy, surgical airway procedures. They transport patients to specialized trauma centers or hospitals. They deliver medical personnel and equipment to zones that are actually under threat or remote locations where you can't really reach by road in a better way. So crew and equipment, you have medical teams like physician, paramedic, flight nurse, aircraft. So the aircraft is equipped with ventilators, monitors, emergency drugs, just basically things like first aid, can keep the person alive before the definitive care comes in. So pilots are trained for low altitude, high precision flight in urban or rural terrains. So why it matters, all right, you can reach patients in minutes because helicopters are fast, offers time advantage over ground transport, so it's fast, improves survival rates because even the time to take the patient back to the hospital is faster. So challenges and consideration is high operational cost. Maintaining a helicopter is millions, right? So safety risks for crews during flight and landing, all right, dispatch accuracy is crucial, and all have you. All right. So this is this concept as related to emergency medical services.